We've all had to adjust our lifestyles due to COVID-19. We've never been in this position before, and we're having to work so much harder at home to look after ourselves. At this time, we've had to maintain rules around social distancing to ensure that we are keeping ourselves safe. This new way of living can feel difficult to manage, especially when living with a long-term health condition and trying to manage that too. Understandably, this can lead to a variety of emotional responses. Now, having said this, we're going to be exploring how you can help yourself stay well during this time with a few key tips of how to manage your well-being whilst at home. Here at the Mental Health and Wellbeing Service, we recently conducted a survey with our clients to find out how this pandemic is affecting you. We found that over 85% of our respondents reported that their mental health has been impacted as a result of COVID, with a significant number of people having to self-isolate or shield due to having a health condition. In fact, if we look at the research on a national level, there are a number of ways that managing a long-term health condition during this pandemic can impact our mental well-being. These include feelings of frustration, anxiety, low mood, anger and stress, just to name a few. In fact, it's very common for our health condition to impact our mood, and actually for our mood to impact our health condition. Importantly, of the key findings from research is that living with a long-term health condition at this time can cause feelings of uncertainty and fear, which can intensify some of the feelings already mentioned. Whilst having a health condition does not make you more likely than anyone else to come into contact with coronavirus, we know that people with a long-term health condition may be more at risk of developing serious illness if they contract the virus. As a result, are advised to take extra precaution to protect themselves from the virus. This might be through methods such as shielding, cocooning, or self-isolating, for example. We are here to help you manage some of this emotional weight that you might be carrying at this time. With that said, together, let's now look at the key things that you can do to help yourself stay well at home during this pandemic. Tip 1. Engage in regular exercise or low-level activity. Regular low-level activity is an important one. We know that having a healthy body can really support a healthy mind. And we also know that times like this can really affect how we feel. As a result, this might take its toll on our physical health. A great way that we can look after our body is by doing physical activity. And this can be something as little as gentle movement like walking or even chair exercises, for example. Now, there's a lot of research that shows the benefits of bouts of activity on our mental health. It can help us to feel good. This is because activity releases endorphins, which are feel-good hormones, and they give us more energy. It also releases hormones that are responsible for managing stress. In fact, many of our clients have told us that just by incorporating simple activity, like morning stretches, for example, this has been beneficial for mood, and it's also helped our clients feel more prepared for the day ahead. If you feel unable to leave your home, there are still a number of ways that you can boost your level of physical activity whilst indoors. Ideally, the aim is that you're just not sitting down for too long without moving around. So just walking around the house, maybe stretching whilst you're sat on your sofa watching TV, or standing up from time to time. These are all really great ways that you can boost your physical activity levels. If you live with a long-term health condition and you want to find out more about how you can incorporate physical activity into your lifestyle, visit the NHS Fitness Studio. Now, they offer a range of fitness plans, fitness guides and videos, all free, aimed at kind of managing your physical well-being if you would like to increase your activity levels. So, for example, they have videos focused on people with kind of back pain, joint pain and fibromyalgia, just to name a few. Tip 2. Set yourself goals. Now, there are loads of benefits to goal setting. It provides direction, motivation, a clearer focus, and also provides a sense of control that we might otherwise feel we don't have at the moment. Going back to the start of the video, I mentioned that research has shown higher levels of fear and uncertainty for people with a long-term health condition during this time. Having goals to work towards can act as almost an anchor, keeping us grounded. The certainty of having goals can almost counteract the uncertainty we might feel around what's going on in the world at the moment. Maintaining this sense of control can boost our resilience levels, which in turn positively affects both our mental and our physical well-being. Now, when thinking about goal setting, we know that it's easier to stick with your goal or small change if it has some detail included. We call these SMART principles. So when setting goals, these need to be specific, they need to be measurable, they need to be achievable, realistic and time-boundaried. For example, rather than your goal being to read a book you've always wanted to read, a more helpful goal could be that by Friday I want to read a chapter or even 10 pages of this book. This feels more achievable and can help you to feel more positive about goal setting. In the support pack, there is some more information about SMART goals and how you can incorporate these into your current lifestyle. Tip 3. Establish a daily and a care routine. Feeling emotionally impacted due to COVID is normal and it's not unexpected. Feelings such as stress and worry can make your underlying condition feel more intense, but there are things you can do to help yourself get through this time. Firstly, think about planning your daily routine and structure. Similarly to the goal setting we spoke about in tip 2, this also gives us a sense of focus and purpose, which can boost our well-being and our overall resilience levels. It's important to structure your day based on what works for you. If you find that your health condition is more noticeable in the evenings, it may be that your most productive hours are between morning and midday. This is where you can get the most done. With this example, the evenings might be used to relax, perhaps chat with others, or maybe just watch your favourite film or TV programme. Similarly, if your condition is more present when you wake up in the mornings, it might be that the evenings feel more comfortable for you to incorporate more activity, and the mornings are more important for that relaxation and self-care time. Now, thinking about your care routine, if you actively monitor your long-term health condition, it's important that you continue to do this as you would usually. Whether that's noting your symptoms or tracking your blood glucose, for example, it's important to be aware of how you are feeling and of how your body is feeling. It might be helpful to consider maybe planning set times in your routine to do these checks. This is so important because feeling able to respond to your bodily changes quickly will help you to keep your long-term health condition under control. Now, this is a great time to mention the Bromley Long-Term Health Conditions Service. This service helps people aged 18 and over living in Bromley and living with health conditions to look after both physical and mental well-being. Now, just some of the health conditions that this service offers support with include things like chronic pain, high blood pressure, diabetes, fibromyalgia, arthritis, and many more. This service is currently running a virtual health and wellbeing workshop, which is designed to support your wellbeing through self-care and to help yourself build confidence in managing your health condition and actually just your health more generally. For more information about this service or to find out more about any Bromley Well service, contact our single point of access. The telephone number is listed below on the screen, along with our email address and our website. Tip 4. Cover the basics. This is an important one and is perhaps more about planning for those days where you might be experiencing issues with your physical health, which could be affecting your mental well-being. This is where self-care is so necessary. Ways to cover the basics include things like knowing your sick day rules. Perhaps write down what helps you when you are having a sick day. What do you need during these times? If it's medications, for example, maybe keep a list of your medicines for when you are running low. You can ask your GP or pharmacist for support with this if it is necessary. If you don't feel able to get out of bed, that's okay. Perhaps just try to open the curtains or the blinds. There are many benefits of daylight on both our physical and our mental well-being. If you feel able to open the window and get some fresh air, that can also offer much benefit. Similarly, if you don't feel hungry, try to ensure that you're drinking plenty of fluids and maybe consider having a simple snack such as plain toast or crackers. If you are able to eat as normal, think about the ways that you can ensure you're getting vital nutrients out of the foods that you're eating. Again, we know that well-balanced meals can have positive effects on both our physical and our mental health. Finally, try to keep the contact number of your GP or hospital to hand. This is important if you notice that your condition is worsening. These professionals will be able to offer you the most helpful advice and guidance around how to look after yourself and your health during these difficult times. Through this video, we've spoken about some ways that you can look after your well-being during this time if you live with a long-term health condition. We've spoken about the benefits of low-level physical activity. We've spoken about how to set goals, why a positive routine is so helpful, and finally, the importance of covering the basics. We would also love to hear from you and how you found these tips. You can reach us on Twitter. Our handle is @BromleyWell, and perhaps send us a tweet with your favourite tip and #HelpAtHome to get involved. Thank you for listening.